more patient, and we need to maybe repeat ourselves, and we need to wait. So many times you will suggest going for a walk, or that you want, we're going to go to the doctor's appointment today, or maybe we're going to, go somewhere. And the answer is no, I'm not going. And then 20 minutes later, if you just let it be, so that's why you shouldn't rush anybody, right? You should have plenty of time. If you have a 10 o'clock appointment, you don't start at 9:30. You start about 8 or less earlier, getting them ready because of that slow processing, right? And so they told you no. It was absolutely no, I'm not going to the appointment today or whatever. I'm not going to get my hair done or my nails done or whatever. 20 minutes later, they're standing in front of you with their sweater or their purse or their wallet and ready to go. Because it took a while before they really understood what you were trying to say. We also have the problem in the why of their insight. Now, there's many levels of dementia, as you all know. And depending on when, sometimes they've had dementia for many years before it was even diagnosed, right? The range actually can go from 10 to 20 years, so it's a long time. And so, by the time you're there, there's definitely been some problems, right? Because you're looking to be at least rested so that the family member or the other caregiver can leave for a while. And so this person obviously needs companionship and may need more than that for safety's sake mainly, and should not be left alone. So that's, by the time you're there, the insight that they have into their problem is varied. You don't really know how much insight they have. And one of the problems is that if you're taking care of somebody who does not have dementia, you can ask them a question. Are you hungry? Are you cold? Do you have pain in your leg today? And you should get an answer. But you can't do that with a dementia person and get a right answer most of the time. You may get an answer. Might not be the correct answer. One of the problems is that they really don't have a concept of what pain is. So, the medical profession is the worst on this. We go in the emergency room, and then the first thing, anyone in the doctor's office or in the emergency rooms or wherever, first thing the medical person's going to say is, are you in pain? And most of them will say no. I've had to run after many physicians or nurses at the emergency room, tell them to come back, please. Have my client turn over, and then you'll see. Or move her right arm, and then you'll see if she has pain or not. Because then we have body language. Without body language, just asking the pain is not really too beneficial for dementia loved one. So environment and communication become very important in both of these situations, in all the situations of why is that behavior happening. So some of it, of course, is disease progression, which you have no control over, and I understand that. But we have to be careful not to just pass everything off as disease progression and not look at environment and look at how we're communicating, because we may be able to help the situation with those two things without getting into just working with the environment and communication. So companions cannot change the disease progression, but often can change the environment and how we communicate. So I think too, we talked about aggressive behavior, and there may be a little problem between what's the definition, what's your definition of aggressive behavior, maybe my definition, and resistance. I'm here to tell you that every dementia loved one is going to have resistance. And so sometimes that's not really aggression. So I told you that you needed to be aware of the why. Why are they acting as they are, okay? Before we can get into how. We also have to know the definitions, and we have to know that before aggression, there's some warning signals. And it's called anxiety and agitation, and it comes in that order. So it's anxiety, agitation, and aggression. So obviously, the best solution for what to do with aggression is what? Don't get there. So if you have the luxury, now I know you can walk in the house and already have aggression, so you may not have that luxury. But if you have the luxury where you can see that somebody is having a lot of anxiety right now, you need to know that if you don't do anything, if that doesn't make any change, if you're not able to distract, move, get the thought processing changing, you're going to lead into aggression. And sometimes just the way we handle that anxiety, what we say in our manner, can make the anxiety escalate, can it not? I think we're all aware of that. Everybody, that's the situation. You don't have to have dementia, right? To have that. You can escalate something that doesn't seem to be that important into a very major problem. So, so the best way to handle aggression is not to get there. So anxiety, as far as the definition is concerned, often with dementia, is that you can just tell, sometimes pacing, but many times just not really being able to communicate well, and that may be a norm for them. But if it is a change, then it often is anxiety. Anxiety most of the time is caused by stress. So as soon as you see some signs of anxiety, which means that the attention span is worse than usual, maybe wringing of hands, maybe moving things around all the time, just not being very restless. If you see that this anxiety is happening, look back. You know, what happened just a few hours ago? Did somebody wake them up very abruptly, or you know, did somebody say something loudly and upset them? I know you don't know all these things, but these are things that maybe you can at least look into. And anytime that you're trying to make somebody do something and they don't understand what you're making them do, that's really high anxiety, right? Because maybe you're there to give them breakfast. And so you've only been there 10 minutes, but you said it 3 times. We got to eat breakfast now. We got to eat breakfast now. That's sort of anxiety producing for many people. So you just have to see, and you have to be aware of the stress level. And one of the things that really happens with stress levels is that we don't keep the routine. And I know that it's very hard for you all to always have the same time schedule and so on, but the more routine and the more trust they can have in you to keep them safe and be a friend to them, the more you will be able to really be beneficial for both of you to do what you need to do. Keep them safe and keep them calm. From anxiety, we go into agitation, which usually is pacing. It could be saying, you know, harsh words, or, you know, talking really bad language that you don't want to hear. It could be using their arms, but not so much physical as it is, you know, like I say, being even more restless than they were with anxiety. So you can see how it adds. I have a client right now, and the girls have discovered, they've been with her for quite a while, and they have found, they tell me, well, the light switch went off. For whatever reason, everything's going fine. Maybe they're reading, maybe they're looking at something, maybe they have just, you know, done, maybe they just had breakfast. Everything's going along fine, and all of a sudden the light switch will go off and she'll become very defiant. And I am not moving from here. I don't care what you want to do. She becomes very stiff and just completely blanks out and, don't touch me kind of thing. And then if you leave it long enough and don't make too much out of it, that light switch will go back, and a few hours later you never knew that you had it. So everybody is different, but this is one situation. Ooh, the chair's just
He's haunted.
The chairs are a little anxiety. Okay. So just remember that all behavior has a trigger somewhere. And unfortunately, the dementia loved one cannot tell you the trigger. And so that's up to us to try and figure the trigger out. Sometimes you can never figure the trigger out, so don't drive yourself crazy doing it, because you can't. So then what you do is, what can I do to try to change this situation? So the good news is you can set your goal to prevent or decrease the behavior rather than eliminate it. Because you're probably not going to eliminate it. But you are going to try very hard to prevent that agitation going into aggression. Now, what do we mean by aggression? By aggression, I mean that if you even get near them, the arms start to fly and they're, get away from me. You're into aggression then, you do get away, right? You don't try to touch at that point. At that point, they could pull hair, they could yell and scream, then you're into aggression. By that time, it's much harder to change than it is at the anxiety and agitation level. So let's go back to the anxiety and agitation level where we want to redirect. Now I know you've been to a lot of meetings and everybody tells you to redirect. I'm here to tell you that it's very